Many thanks for inviting me today to talk about geriatric medicine and comprehensive geriatric assessment in geriatric medicine registers training day. I am Dr. Roy, consultant physician, geriatrician and gerontologist. Many of you or many of us are not aware of this special branch of medicine or are not interested at all. But history and evidence tell the different story. Geriatric medicine is the largest medical specialty in the world. To be a competent geriatrician and gerontologist, a physician should be competent in acute internal medicine and other special branches of medicine like cardiology, neurology, stroke medicine, musculoskeletal, heart or cardiac, respiratory, psychosocial, so on. Before talking about the history, how this specialty came out, and who showed us the light at the other end of the tunnel, in the development of this specialty. First of all, we have to know what is geriatrics and what is gerontologist. Geriatrics came out from the word geras, means old people, and atrikos means physician. In short, geriatrics is the specialty which deals with the people above 65 years old. Again, we can classify all people into three categories: young old, 65 to 74, old, 75 to 84, and oldest old, above 85 years old. On the other hand, gerontologist is the specialty which deals with the aging process and the phenomenon associated with this process. Going back, in the past, geriatric medicine was regarded as the specialty of disposal medicine. As a convenient place to dispose of unwanted patients. Without lack of proper medical supervision, lack of diagnostic facilities, lack of rehabilitation. But this old tradition has died down slowly. It was regarded as second-rate specialty, looking after third-rate patients in fourth-rate facilities. But because of the transformation taken place over the last 50 years, and there was a blessing in disguise, this special branch of medicine has become the largest specialty in the world. Now we are in modern geriatric medicine. We are looking after first-rate patients in a first-rate specialty in a first-rate facilities. The question is that who is the transformer? Who was the transformer? If you want to be a competent geriatrician or a trainee geriatrician, you have to know who is the transformer. Many of you like to watch movies, as I do. There are 7 series in Transformer movies. The last one is Rise of the Beasts. But in geriatric medicine, there is only one transformer. Dr. Marjorie Warren, the mother of geriatric medicine, comprehensive geriatric assessment, and multidisciplinary team assessment. If you know her, you will know the whole geriatrics. If you know the history, you will know the whole geriatrics, which is the basis of geriatric medicine. Interestingly, Dr. Marjorie Warren was a non-physician who created geriatrics out of her interest. She was born in 1897, and she was the eldest daughter of a barrister father. She graduated from Royal Free Hospital School of Medicine, London, in 1923, and she joined as assistant medical officer in general surgery in West Middlesex Hospital. Surgery was her primary specialty. It was her interest, how she performed thousands of surgeries. In 1931, she was given the responsibility as a medical superintendent. Actually, she learned all the organizational skills during that time, and these organizational skills are very much important in the field of geriatrics. As Professor John Brocklehurst rightly defined geriatric medicine as a specialty, as an organizational specialty, where we physicians or geriatricians provide care complex, and the primary aim is to meet and overcome breakdown in independent living among all people. So during that time, Dr. Marjorie Warren gained all the organizational skills which are needed particularly to run this specialty very well. 1935, was a turning year. Her career took a huge turn in 1935. She was given the responsibility to look after around 800 patients in a poor law infirmary in London. Everyone should know what is poor law infirmary. Poor law infirmary in the past, almost 50 years back, they used to dispose all the elderly, sick, bedridden patients in that infirmary without lack of proper medical supervision, lack of proper nursing care, lack of rehabilitation, so on. Dr. Marjorie observed that only nursing care in that infirmary kept that elderly people alive, but lack of proper medical management and rehabilitation made them disabled. She took the challenge. She demonstrated a heightened level of optimism and hope with compassion, dignity, respect, keeping the patients at the center of the care. She examined all 800 patients from head to toe, back to bone, exposed with dignity and compassion, and managed them accordingly on the basis of their mentality, their mental faculty, their continence, mobility, and rehabilitated them accordingly. She observed that these elderly patients are dynamic and are very much complex with multimorbidity, polypharmacy, social vulnerability, lack of resilience and plasticity. She thought that this cohort of patients need a comprehensive assessment. One size fits all approach would not work here. Again, she assessed all the patients herself, took the help of physiotherapist, occupational therapist, podiatrist, and other allied health professionals, depending on the assessment. With her innovative approach and comprehensive assessment, she was able to discharge almost 600 patients over the couple of months and made the beds available for real sick patients. Actually, this kind of practice we are doing in our acute frailty unit in Darrenville Hospital, and this is nothing but the innovation of Dr. Marjorie Warren. Dr. Marjorie Warren was a specialty, but she wanted geriatric medicine to be a part of general internal medicine training. She wanted geriatric medicine as a special branch, as a separate branch of medicine, but wanted this special branch of medicine to be a part of tertiary level hospital with an access to proper diagnostic facilities, management facilities, and rehabilitation. Ultimately, her dream came to reality. She established the geriatric medicine, comprehensive geriatric assessment with multidisciplinary approach at the time of National Health Service, Bath, 1948, and we are in the modern geriatric medicine as a result of our innovation and blessings. Nowadays, geriatric medicine is a very special medicine, biggest special medicine branches in medicine, where we provide holistic care. What does matter most to the patients? Keeping this principle in mind, we provide comprehensive assessment for the patients, keeping the patients at the center of the care, engaging with the family, general practitioners, and other healthcare professionals. She emphasized on the training of doctors in this special branch of medicine for each and every one from the beginning of the career. The whole approach of this comprehensive geriatric assessment is that to provide holistic care, to provide comprehensive assessment, to optimize unnecessary medications, and ultimately send them to their home, and to avoid unnecessary hospital admissions. She observed that elderly people prefer to remain in their own home with their familiar surroundings, their pets, cats and dogs, with them, family at the bedside. She emphasized that these elderly patients should be managed or should be retained in their own home as far as possible, but of course not compromising the safety. But there is a tragic end. In 1960, she was killed in a tragic road traffic accident in Germany. All the passengers in the car survived, but only she died. Hence, it was reported that Dr. Marjorie Warren was not only sympathized with the patients in the hospital or in the ward, but she also demonstrated a heightened level of sympathy, optimism for the passengers in the car and the road ahead. But the legacy left behind is always giving us momentum, is propelling us to move forward in this special branch of medicine, to provide holistic, optimistic care with optimism and hope. Keeping the patients at the center of the care, looking at the horizon, the whole patient, their vulnerability, family, their medications, social connectedness, all these things. So to cut the long story short, geriatric medicine is nothing but the special blooming branch of medicine, and a lot of research is going on in this medicine to till date. Lot of research is going in to find out how to delay the aging process, to find out medications which can delay the aging process. I think this is not very far away. Hopefully you will get the answer soon. So as a trainee registered in geriatric medicine, I think you have to know Dr. Marjorie Rowan very well. You have to know the legacy left behind. This is your future, and your journey starts here today. Any questions? Thank you. I hope you have enjoyed my talk today. I have many things to tell about her, about the history of geriatric medicine. Hopefully, in my future lecture, I would meet you again, and I will talk about in more depth. Thank you very much for watching my lecture today.